Hello, and today we are going to talk about internal family systems therapy. So, internal family systems therapy was created by Richard Schwartz in the 1980s. He thought that there was a lot of different elements, a lot of different parts to one's personality, and so it's essentially like a family where all the family members continuously communicate with each other. It's most appropriate for people with depression, anxiety, phobias, PTSD, and chronic health conditions. As you can imagine, if someone has a chronic health condition and then we begin to talk about our different parts, we can talk about which ones can help us focus our attention somewhere else, therefore lessening the pain or the suffering. When we think about who shouldn't use IFS, we think of schizophrenics and anyone experiencing psychosis or delusions because it can actually worsen the delusions, especially in the case of someone who believes there are other people in their head or in their thoughts, and then we ask them to talk about the different parts and the different people inside our head. It's just going to end up making things worse. So, the main basis of IFS is the idea that we all have a core self. So, this is a positive self, and this is waiting to be identified and explored. So, often when people come to IFS therapy, they haven't yet accessed their core true selves. So, we also have different roles, which Schwartz actually labeled. So, let's go through the main three. The managers are the protective role, and they seek to control our surroundings and manage our emotions in order to avoid hurt. Now, the exiles are driven by shame or fear, and they're generally hurt from experiences of the past and any negative memories. So, when we look at how parts interact with each other, for example, if we have a dominant manager, then this continuously seeks to keep exiles from our conscious awareness so that we can avoid hurt even more. Now, when we look at a firefighter, if we have a dominant firefighter, that is because our exile part has gotten too much and we have allowed the shame, the fear, or the hurt to consume us. It's become overwhelming. So, when a firefighter is suffering from all this overwhelm, it comes out in our behavior. So, for example, through addiction or through binge eating. Altogether, Schwartz stated that there are 5 P's and 8 C's of positive traits, and these are all at the center of our core self. So, in understanding which of these C's and P's the patient identifies with, we can sort of see how much of the core self they have access to. In the 8 C's, we have confidence, calmness, creativity, clarity, curiosity, courage, compassion, and connectedness. Once the patient has recognized each and every part of themselves, they can allow all of the parts to coexist and they'll become less of an extreme person. Now, looking at the 5 P's, we have presence, patience, perspective, persistence, and playfulness. So you can probably see how these would counteract the core selves we discussed earlier with the exile, the manager, and the firefighters. Once we allow all these positive traits to come into play, we can manage ourselves more equally. Now we understand the core basis of IFS, we can go through the 6 core stages. So, first we have finding. In this part, we identify the parts of our mind and body which need some attention. Through focusing, we pay attention to those relevant parts. And then with fleshing, we describe this part and we experience it so we come to understand it on a deeper level. Hence why we call fleshing it out, because that is creating a true understanding and description of the people or parts inside us. From here, we go to feeling, where we then explore how we feel towards each of these parts. Now, befriending is all about being curious towards these parts and once again exploring them on a deeper level. until we accept the presence of that part. So here we are allowing them to coexist with each other. We're not trying to deny ourselves of parts, we're not trying to run away from them. We're just trying to say, okay, I understand that this is inside me and I'm okay with that. From there, we move to fear. In doing this, we understand from the part's perspective what it fears if we changed its role. From acknowledging these fears, we can understand whether or not we want to keep acting from the part in the way that we currently do, or if we want to rationalize this fear and say, okay, I allow it to coexist, but now we speak from a different part of myself. We speak from the positive core traits. Even though this part is still here, I respect and understand it. However, now I'm ready to live in equilibrium. Thank you for coming to my mini lecture on internal family systems therapy. I hope you enjoyed. Please give a thumbs up and feel free to subscribe for more videos like this. Bye!